Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I am elated to be back in effect mode. This is episode number 339. Yes, you did hear that correctly. Episode number 339 of the Ask Dr. Angela podcast. Today, the topic is doulas. What are they and where do they fit into your pregnancy experience? And our guest today, first of all, Mary, I am so happy and excited to have you as my first guest back in the saddle, so to speak. What you need to know, obviously, you know that I'm an OBGYN, but what you need to know about Mary is that she is a phenomenal doula. And I walked into a room not too long ago. One of my patients was utilizing her services. And what I'm going to say is that every experience that I've had with Mary has been phenomenal. Your level of collectedness, calmness, and the support that you give, I'm going to say our patient, because we have a mutual person that we were providing care for, I can't even describe it. Like amazing. And I know that sometimes people might feel a certain way or have some preconceived notions about doulas and what they are, the services that they render. But what I'm going to tell you is that every experience that I have had with you has been phenomenal, so much so that I wanted you to be on my podcast so that we could talk more about what you do. So before we jump into it, I'm just going to jump into a couple of, the things that I know about you. Mary is the founder of Philomena Birth Center. I think that was founded in 2020. You are a Doulas certified birth doula, and I am going to ask you about that certification, what it means. You're Lamaze certified. You are a certified lactation counselor, and you are a childbirth educator. For me, when I read all of those credentials, it's like one-stop shopping. And what I mean by that is you cover the whole spectrum. Your breadth of knowledge seems to cover, things that women will need, maybe even prior to pregnancy, during pregnancy, and, during labor, and even after labor and the postpartum experience. So I want to touch on all of that. So here's the first question. What is a doula? What is that?
That's a great question. And that's a question a lot of women ask me and a lot of people ask me. So as a doula, I am educated and trained to support women through pregnancy as well as through labor. And there's different elements of what that support looks like. And I always like to emphasize to people that doula support really starts in pregnancy. We want to be connecting with our moms after all their OBGYN or midwife appointments. So we are really walking alongside them throughout pregnancy and then in the labor experience as well. So the kind of support that we're offering, whether it's childbirth education support. So I became Lamaze certified just exactly for what you said, Dr. Angela, is I really wanted to be a one-stop shop for moms, that many moms become pregnant and they have this moment where they realize, wow, maybe I've had this goal to be a mom for a long time, or maybe people have talked to me about motherhood, but no one has really spoken to me about what to expect with giving birth. And I really find that we are not a birth literate culture in a big way. So moms become pregnant and they don't know what the stages and phases of labor are. They don't know what questions to ask their OBs at their appointments. They don't know what's within the scope of normal and what's outside the scope of normal. So as a doula, I'm really trying to provide educational support throughout the pregnancy experience. And whether that's explaining stages and phases, understanding tools that OBs and midwives can use in labor, encouraging moms to make informed medical decisions. And then we talk a lot about managing contractions, about what they feel like, natural pain management techniques, how to utilize an epidural well, if that's something they're planning on doing. And then we carry all that education, all that support from pregnancy. It's really important that that foundation is there, and we carry that into the labor room. And my goal when I'm supporting a mom in labor as a doula, we join our moms when labor begins, and we support them throughout the whole process. So we are by their side. Really, when things become more active, when a mom is 3, 4, 5 centimeters dilated, is when we physically join them. And in the room, what I'm personally thinking about when I'm with a mom is I like to step into her space, look around the room and think, how can I help this mom feel safer? How can I help this mom feel more supported? And how can I help this mom better understand what's going on with her labor? And with every family and every mom, this looks different. So sometimes it's providing physical hands-on support, helping moms get in different positions to manage labor. Sometimes it's bedside education and advocacy, really facilitating conversations with doctors, making sure they understand everything that's going on medically. And sometimes it's just like making the room feel good in there. Sometimes I'm just turning the bright hospital lights off, putting some LED candles on, putting some music on, and suddenly I see the mom relax. Her nervous system sort of settles down. Labor becomes more manageable. She feels more confident about the experience.
I think that's wonderful. I remember, the experience that I had with you. There were LED lights. There was like aromatherapy. There was amazing music. It was fantastic. One of the things that I really like about what you said is the advocacy part for patients, because really one of the things that I often see is just patients are afraid to ask the questions. And one of the things that I try to explain to my patients and advocate for is, I tell them, this is your experience.
100%. That's what, exactly, Dr. Angela. And I've seen that working with you at several births, is I never want a mom to feel like something happened to them in the labor room, right? My goal truly as an educator, as a birth doula, is for women to realize their agency giving birth. And for them, and the reason that I emphasize this childbirth education component of it is because I want them to become advocates for themselves. I want them to understand the birthing process, understand their options and choices. And I say good conversations with your doctors start in pregnancy, so you can carry that conversation and that relationship into the labor room. So my job as advocating for moms, I'm not often talking to the doctors on my clients' behalf, but I'm making sure that they're asking good follow-up questions, that they themselves understand the risks, the benefits, and that those decisions that are being made are truly informed medical decisions. And not only for the mom, not only for the birthing person, but also for the partner in the room. A lot of times I really see doula support as family support. And I want them, they can feel overwhelmed and confused and it's intimidating to be in a hospital. So I want to normalize that, empower both of them to realize you're making the choices here. This is a core memory in both of your lives. And it's important that that core memory feels empowered, feels like you both had agency in the room.
Exactly. Let me ask you this. Do you ever get any kickback or resistance from persons such as myself being present in the labor room? For me personally, when I speak with patients and they bring their birth plans or whatever they have, and they're like, well, can I have this person present or that person present? My whole thing is, number one, this is my dog in the background if you hear him whining at me, this is your experience. And certainly I have the role that I play in the delivery room, and everyone is a part of the team, and I think that for me, just going into it like that, I'm Dr. Angela, Mary is Mary, and she provides the resources and the services that she does. Labor and delivery is a team sport. I think that's probably the biggest thing that people need to embrace.
Absolutely. And there's so much going on, right? There is a lot happening medically that needs impeccable care. And that's a lot to hold. And that's a lot for the doctors to hold. That's a lot for the nurses to hold. But also birth is more than just a medical event.
Yes.
It can be a cultural event in a family's life. It's a major transformational moment in a mother's life. So and that needs care. And as a culture, we don't think about that as much as we should.
Sure.
So the emotional well-being of mom in labor really needs someone by her side that can make her feel safe and supported and educated in the moment. So I think those are very clear roles and very clear things that need their own set of expertise. You ask if I've gotten pushback from OBs. I have over time. I feel like it's all about also how we hold ourselves and we communicate.
Yes.
I really think an important skill of a doula is effective communication. So whether that's effective communication with the client, so being able to talk to them in a way that they feel heard, they feel seen, and they feel like they can be both strong and vulnerable with you, and effective communication with the doctors and with the nurses. So really being able to, be respectful, ask good questions, and put things in the mother's hands. One thing that I have learned over time is if I feel like my client isn't having good conversations with their doctor in pregnancy, I advocate for them to change providers, because that is it's just so important.
You're
right?
Absolutely right.
There's a different fit for everybody, and we work, what's amazing about doulas, I think, is a unique perspective we have is I go to hospitals all over the state. So I am seeing how care varies from hospital to hospital, how policy changes hospital to hospital, and how practices change and provide different care. So one practice might not be a good fit for one mom. It might be a great fit for another. That I think that if they can find that their providers listening to their birth plan, hearing what they're saying in pregnancy, we can get that care in labor as well. So I kind of try to address that before the mom's even giving birth, that if they don't feel heard in the appointments, then let's talk about shifting to another hospital or another practice.
You know what? I'm so happy that you said that. And I'm actually going to highlight that, because one of the main reasons that I see a lot of new people and patients, whether it's gynecological patients or, obstetric patients, it has to do with the lack of connectedness, or feeling like the provider was not listening. And I tell patients all the time, if you are seeing someone that you don't feel acknowledged, heard, then you need to find someone else. I always want women to realize that they have a choice. You always have a choice.
And that's my mantra, honestly, is there are always options and choices. And knowing that and really owning that is a big deal. And we live in New Jersey and we have so many options and choices. There are many local hospitals just within our area that you can choose from. We're even lucky to have a few birth centers in our area you can choose from. So I think it's really important that women realize their agency in pregnancy so they utilize it. And that there isn't, I think some people will think, well, all doctors are going to be dismissive, or, it's going to be the same no matter where. That's where I find people hesitant to change. And I really try to give them the benefit of the doubt that you deserve to be heard, you deserve to be listened to. And there are amazing doctors and midwives in our area who are going to give you the care that you're looking for. It's out there.
So let me ask you this. How did you come up with the concept of the Philomena Birth Center? Talk to me about how that came to be.
So, and I just want to clarify, we're not a birth center, but we're a childbirth education center.
Perfect.
So how I kind of came up with this model, and, what my goal is I first became a DONA certified birth doula. So just a little bit of context. My mom had been a midwife. She was a midwife before she had children. And then as I was growing up, she was a Lamaze childbirth educator and a lactation consultant at the hospital and a nurse on the postpartum floor. So childbirth education, this kind of work was always kind of in my life. When I got pregnant with my first, I had a doula who made a huge impact on just my confidence level through pregnancy. She helped me find the midwife practice that I ended up working with and walked me through my birth. And I couldn't believe how much it impacted really my outcome and impacted how I felt afterwards. So I felt drawn to this work. I did my doula training when I was pregnant with my second, and I started out just with that, just attending births. Sure. And I realized in my prenatal meeting, so a normal doula package includes 2 prenatal meetings, continuous labor support, and 1 postpartum visit, and then phone conversations in between that. And I would realize in these meetings, there was holes in my knowledge. People were asking me, can you explain this? Can you explain that? And there was holes in their knowledge. And I realized, okay, my next step is I have to become a childbirth educator because they need more. Sure. So then I went on and became a Lamaze childbirth educator, and I switched my doula package to include access to 6 childbirth education classes. So all of our doula clients take these 6 classes. We do a stages and phases of labor class, an understanding medical interventions class, natural pain management, and then we prepare moms for the other side, a breastfeeding class, a newborn care, and a postpartum planning. And the goal behind this is to really use education to normalize birth. I think if we can take the fear out of it, education brings down fear, it becomes much more manageable. So normalize birth, build up mom's confidence around the process, build up partners' confidence around it. And then we can use these 2 prenatal meetings, which are one-on-one meetings that we do, to just hear from the mothers. It's really, these meetings are times where I open up questions like, what makes you most excited about giving birth? What gets you most nervous about giving birth? And we just get to unpack it in that way. And they don't have to be meetings where I'm doing all the talking, explaining everything. They're meetings where I'm listening. And my goal through all of it is, I have another mantra I live by, is support in education changes outcomes. And we see that in all facets of life, right? Yes. And I just apply that to birth. And I'm seeing it, Dr. Angela, ever since. So about 2 years ago, we switched this model to the 6 childbirth education classes, and including the doula support and the postpartum visit. And our moms, and particularly our partners, because partners come to all the classes as well, are walking into these births so much more confident, asking good questions to their doctors, improved outcomes. And it's amazing. It's amazing to watch that. And for it to feel, like I said earlier, they're learning to advocate for themselves in a big way. Sure. And I see that, and that gets me excited.
So here's a question for you. How long are the sessions? You mentioned 6 sessions. How long are each of these sessions?
So our classes are 2 hours in length. And last night I taught our stages and phases of labor class here. We had 8 couples, so I had 16 people. And I love it. I fell in love with doula support first, and now I'm just so inspired by childbirth education. Because I realized with the starting point is low. Most women don't understand what their body is going to go through. They don't know that there's even an early labor phase, which for most healthy moms is a good time to stay home and labor at home. They don't know how to time contractions. So it's like, you can walk into a class like that and not know much, and walk out with a lot of really good information and confident that I don't have to go to the hospital the second the first contraction hits. Or the partners are like, okay, in early labor, I know how to give this kind of support, in active labor, this. So they're 2 hours in length. What did you ask another follow-up, Dr. Angela?
No, that's great. Yeah. One of the things that I really like about what you've said is just the empowering and the educational piece, because really most apprehension and fear is just from not knowing.
It's for
And
100%.
one of my favorite phrases is knowing is half the battle. So when you know, then you are more at ease.
100%. And you know, we don't see birth in our culture. We don't talk about birth. And that's huge, you know. So this story, this, you know, knowledge isn't being passed down woman to woman in the way that it used to be. So I'm really trying to change that. You know, we even here, we're doing a birth story circle here on February 23rd in our office. And this is the second time we've run this. I have 10 families sign up for it. And it's where we all come together, the moms come, and everybody shares their birth story. And what's really nice is they get a chance to, again, talk about how their birth went, relive it for a moment, and then share it with other women. And we do it here because women hear stories from hospitals in this area, from providers who, you know, they're also working with, and it normalizes the experience and builds up confidence for the pregnant moms in the circle as well. Right.
So one of the other things that I really love about the services that you provide is the postpartum support. So we got the baby, now what? Specifically, you know, the home care. Do you provide home care?
So we do a little bit of postpartum support. I have 2 postpartum doulas who work with us. That's not where I thrive. My world is, I love that childbirth education and that labor support. But I want to make sure our women are carried all the way into that 4th trimester. When I teach childbirth education class, I always say the birth of the baby is the most important part, is the most exciting part of the physiological process, but it's not the end. And your body still has 6 more weeks of important work it needs to do for your health. And I really try to stress this to moms, physiologically, what's going on in that period, and then the huge life shift that happens. And, you know, it is disappointing because moms get discharged and then often don't see their OBs again for 6 weeks, which is a long time to not touch base with someone that they've been seeing weekly beforehand. And so our support, we do 1 postpartum visit. So I come to the house, and when I come into the house, I sit there with the mom and I try to see what's going on. Does this mom need breastfeeding support? Is she telling me that, you know, the latch hurt is low? Is that where we need to take this meeting? Or does this mom just need to process her birth experience to me? A lot of moms, I'll say, tell me your birth story. And I'm always surprised what they remember, what they don't remember, how it has settled with them since we've seen each other. That can be a big part of that visit. And then a big part is referrals and references. Does it seem like mom is struggling mentally? Am I seeing signs of postpartum in her?
So I can ask you this. Are you really still seeing women that aren't seeing their OBGYNs until like 6 weeks postpartum? And the reason that I'm asking is ACOG actually changed that dictate years ago. I know from my practice, we bring our people back like the following week. And it's because, you know, we're at a different stage. We've transitioned to the next phase. So it's an opportunity not only to follow up on any comorbidities that may have been existing during the pregnancy, whether that's diabetes, high blood pressure, whatever, but it's also to make sure the mom is okay. Mental health, postpartum, you know, all of these things. So I'm surprised, but maybe not surprised, that people still are bringing their patients back.
That's the I more common than not, it's 6 weeks that I'm seeing moms get follow up. And I agree completely. And I say to my moms, because there are so many things that come up postpartum, call your OB, tell them you want to get in sooner. Because I will be honest, I've walked into postpartum visits and I've had the moms call the OB as I'm sitting there, because they're saying to me, oh, I walk in and they have all the lights off in the house and their head's on the pillow and they say, oh, I have a headache. I haven't slept for 2 days. I'm like, no, this is not a normal headache. They think like, oh, I have a new baby. I'm stressed. I have lack of sleep. Of course I have a headache. And I'm saying, no, this could be many things that need to follow up immediately. So I do. And I hope for that there is more support postpartum in all ways, you know. So we also offer a postpartum planning class. And in that class, we talk about how to set up successful routines at home, how as partners, who to bring into your circle when you get home. Are there, family members who you feel comfortable with asking for help? I feel like a lot of women, we're very self-reliant in our culture, right? And people don't find it easy to ask for help. And especially with things like, I need someone to do my dishes or take out my garbage. And it's a moment in life where you need help and you need to lean on your community. And hopefully there's someone in there that you can bring in to help in that way. So we really want to set up our moms for success postpartum as well.
Yeah, we are so trained to just do it ourselves and not to
We're
rely,
so trained,
on the community around you.
absolutely.
Yeah, for sure. So I understand you come from a long line of midwives or providers, because you and I have that in common. So I'm gonna let you tell me your story, and then I'm gonna tell you mine.
Well, I come from, really my mom. So both my parents were born in Ireland. And I also want to preference this with my mom spontaneously got pregnant when she was 47 with me. So my mom was an older mom, and she always said, like, way before, there was so many women having babies in their 40s. So my mom grew up in Ireland, and she went to nursing school in England. And when she went to nursing school in England, she decided to continue her studies to become a midwife. And she really was of that generation where she rode her bike to women's houses to deliver babies. And I know, and she had privileges at that time to deliver in the hospital and at the home. So she saw birth in both of those settings. And then she moved to America. And when she came to America, things were really different here. It was a time where really there was not midwifery care in the hospital setting, really at all. And there was a lot of even twilight birth still happening at that time. So she came here, and it was a culture shock in many ways. In England, she was running labor and delivery floors. She was really seen as the expert there. So she transitioned to become an L&D nurse, and then really spent most of her time on the postpartum floor, and then went on to become a Lamaze childbirth educator. And that really became, I would say, like her heart center, was teaching Lamaze at the hospital where she worked, and then becoming the lactation consultant there as well. So really, and also just a strong, I always say, like, my mom lived her life as a midwife. Like, she knew how to listen to people well, and how to help them understand what their needs are. I know that's a hard thing to say, but if you've worked with good midwives, even good doctors, good providers, there's just this special magic of the way that they know how to show up for another person and allow them to bring themselves forward. And my mom had that skill. And birth was something, she normalized in my life as a young girl, and even when I was pregnant. So when I am supporting families, and even when I did my doula training, and it's interesting, I want to hear what your perspective on this is, Dr. Angela, since you say you also feel like you're carrying your lineage forward, I do feel guided by my ancestors in some way. I do feel that there's this knowledge around holding space for birth that is even bigger than what I learned in my doula trainings, than bigger what I learned in my Lamaze training, that there's a way of just showing up in the room for women that feels very ancestral to me. And that I know things, not because I've necessarily read them in books, and I never stop reading books, but just because that knowledge has somehow been passed on to me. And I do very much own that and use that knowledge as well. And I also say that, my grandma had all her babies at home. I am the first, and because my mother was older than when she had me, there's almost a skip generation that happens, that I'm the first generation that was born in the hospital. So when there was an ancestral knowing of birth in a different way that I'm a little bit closer to. Both of my parents were born at home in Ireland, as was everyone before them.
Sure. Wowzers.
Yeah, and I
That's
want to hear
amazing.
your story, Dr. Angela. So you
So,
come from a
so this
lineage of,
this is funny. You know, first of all, I always tell people that I was born to be a physician. Like I was that kid
yeah,
that
right?
when I was like 3 or 4 years old, I told my parents that I was going to be a doctor. And
Amazing.
luckily they believed me. And when I say they believed me, I mean that they, provided every resource to make sure that that happened. I originally thought that I was going to do some sort of surgery, specifically orthopedics. But one summer I did a program at the University of Cincinnati. One of our family friends, Dr. Crawford, who was one of my mentors, was like the head of orthopedic surgery at the University of Cincinnati. And so I shadowed him for a whole summer. And I realized after that really great experience that it probably was not going to be the field for me because it was male dominated. And I'm a small Black woman, and I didn't feel like having to fight those battles that I knew would come along with that. So when I finally got into medical school and got to my third year of residency, I was still thinking I definitely want to do something surgical. I thought general surgery, but I that kind of got pushed to the wayside because I needed something with a little bit more continuity of care. And most of the general surgeons, I did not find to have the most pleasant personalities. Not all general surgeons, but a lot of the ones that I came into contact with. So as a third year medical student, my first rotation was actually OBGYN.
Okay.
And I drew the short straw, meaning I was the first medical student that had to take the call, unbeknownst to me. And that one call night completely changed my life
Yeah.
because we took people to surgery from the ER. We did, a ton of deliveries, and then just seeing the patients and really the generation and generations of patients in the clinic, moms, grandmothers, daughters. I thought this is definitely in my wheelhouse because, the complexities that go along with, the physiology of pregnancy and the medicine that follows that are very challenging. And then you've got the surgery on top of that. And so I ended up doing OBGYN because it was like the best of both worlds. And then lo and behold, not even knowing,
Uh-huh.
I will also tell you that the midwives were very instrumental in my training, and that probably contributes to my very handoff approach in
Yeah.
labor and letting moms and babies do what they just do naturally. I tell most patients, I just show up for the delivery because the mom and the baby really do most of the work. But, I ended up in OBGYN, and then, my aunt, who's like the family historian, shared with me just randomly. She's like, that your great grandmother was a midwife and your
Wow.
great grandmother was a midwife. And so I was like, it's really interesting that this is what I ended up doing, you know?
Yeah. I think there's something to it, and
Yeah.
most people that I talk to who work in birth do have that click that happens to them where they're at their first birth or they start doing
Yeah.
this work and there's just something that's like, oh, this is, for me, it just felt like I know how to do this. This is something
Yeah.
that feels right and that I can be there in that moment for women.
So let me ask you this, because you touched on something that I think is a huge misconception. You mentioned epidural, and I know so many people that think doulas are anti-epidural. And so just elaborate on that.
Absolutely. Yeah, so I think that is a huge misconception. I think people think doulas and they think, unmedicated birth, all natural birth. Some people even think doulas, when I tell them I'm a doula, oh, do you only go to home births? And I primarily go to hospital births. So
Right.
it is a misconception. For me, like we talked about earlier, Dr. Angela, I want moms to realize they have options and choices. I want moms to feel like they have agency in the birth room. And that is not, I have no agenda when I go into the room and I'm meeting a mom. There is, I always like to say too, there's no easy way to have a baby. It is hard work no matter what. So what I want moms to understand, and I talk about how to optimize an epidural. We talk in our understanding medical interventions costs, how to have an empowered epidural birth. I think the first thing to do is to think about, I use something, it's actually a really great tool. It's Penny Simpkin, who started the doula movement in the United States. And she started DONA, who I'm certified through. She has a tool called the Pain Medication Preference Scale. And it's a number, I think it starts at +7 and goes to -7. And you look at it and kind of figure out, how do I feel about getting an epidural? Am I someone who wants to get one pretty early on? Am I someone who my goal is actually to birth my baby without getting one? And everyone falls somewhere in between. So I have all my moms look at that and kind of get a sense of where they're at now. And we talk about how often best outcomes, if you can get to active labor before getting an epidural, that optimizes being able to use movement to your advantage. So to get baby to come nice and low, keep that pelvis open, use movement for pain management. I think that can be a great goal. Again, I preference that with labor feels different in every person's body. Labor presents itself in so many different ways, that I want moms to know that that there's many ways to birth your baby, and that you can have an empowered epidural birth. And then if you come to me and you say, Mary, my goal is to have an unmedicated birth, is not to use an epidural. I say, okay, we know what you don't want to use. Let's figure out what you do want to use. What comfort techniques are going to work well for you? Let's practice them all, and let's get you prepared throughout pregnancy for, like, I always say, like, we prepare our mind and we prepare our body. And let's do that as best as we can. We always control the controllables. And then we see what happens, and we be gracious with ourselves. And it's two people that work here, right? It's your body and it's your baby's body working together, and we see how things unfold. But I think the biggest thing is just, and especially as doulas, it's so important that we don't have an agenda for anybody's birth, that we're meeting women where they are, and that the goal is that they're feeling heard, seen, that they have this agency, and there's no right or wrong way to birth. And there's no easy way to have a baby. It's hard work no matter which way you do it. It's the good hard work of life is what I always like to emphasize. But it's definitely hard work.
I think that one of the things that I really love about what you've said is just kind of just with regards to just the choices that women have and continue to have during this whole process. And one of the things that I like to let women know about is, labor is unpredictable, if nothing else. And so just, letting women know, even if you decided that you wanted this, you are always allowed to change your mind.
100%. And I always say that with an epidural, say one of the best parts is you don't have to make that decision ahead of time. As we make that decision moment by moment in the labor room.
So you mentioned to me that you have someone that's in the hospital. What does being on call look like for you? I know what it looks like for me. Do patients have like your direct line? Do you use an answering service? What does that look like for you?
That's a good question. I'm always on call right now. We're busy in the best of ways, but I am trying to figure out what that looks like exactly. So with our doula support, so you work with two doulas. So it's myself and Carrie Burke. She is also DONA certified doula. She's a Lamaze childbirth educator, and she's a Lamaze, and she's a massage therapist. Her business is At Peace Birth. She is fantastic, amazing, and she really is just so much my support as well as our client support. So all of our doula clients work with two doulas. So they are meeting, we're both texting throughout pregnancy, talking on the phone at the meeting. So they have a strong relationship with both of us. And then we share that on-call schedule, and it looks a little different each time. Our clients have access to our direct phones. I don't have an on-call service or anything like that. That sounds sort of nice. And my husband's very patient with my phone ringing in the middle of the night. And what I tell clients is this, is I say, call us when you think labor's begun, even if you're not sure. So we talk to them, often they'll call, it's always the middle of the night, as you know, and I'm feeling some contractions on and off. do you think this is labor? Do you think this is not? And, we offer a little bit of advice. Check in with your doctors if you feel you want to touch base with them. Maybe take a warm shower, maybe hydrate, see if you can lay down, see if you can rest. Early labor, the best thing you want to do is rest, nourish yourself, hydrate. So we're checking in with our moms about every 2 to 4 hours when they're in that early labor before they're even at the hospital. But yeah, I'm always on call. We do anywhere from 4 to 8 to 12 clients a month. It's busy, Dr. Angela. It's the best kind of busy. And as you know, sometimes quickly, sometimes slowly. Sometimes these babies are fast. Sometimes these babies are slow. And we primarily, if I join a mom in labor, I'm there with her really until that baby comes into in her arms. Sometimes it is long, and we do give ourselves the option of I've been with a mom for, let's say, 12 hours or more, I'll say, hey, I have to tap out, but Carrie's going to come in and provide the rest of that support in that way. So they do have that continuous doula support, but sometimes we do trade out.
Yeah, of course. Most of what we do is waiting.
Yeah, I know. It's just, and what I think about is just like holding that space. I think that's a really important skill for any birth worker, for a doula. It isn't a situation where you have to kind of prove your worth, right? You want to walk in and meet the moms. And for some moms, it's just like, Mary, I need to know you're there. Yeah. And I'm just sitting there in the chair, and they feel safer and more comfortable with me in the room. And them and their partner are doing a beautiful job laboring together. He's, maybe massaging her back and giving words of encouragement. And she's just looking over at me every once in a while. And I'm sort of nodding like, yes, this is going well. Yeah. And sometimes it's simple stuff like that. And then other times it is like the whole time hands-on support. I'm there coaching mom through each breath, helping her navigate complicated medical decisions, really being more forward present in another way. But it looks different every single time. And that's what I'm sure that's what you also love about it, Dr. Angela, because birth is such a great thing to work in because it's endlessly fascinating. And like you even said, it's, there's so many levels to it. You can forever learn about all the medical aspects of it. You can forever learn about all the different cultural aspects of it, all the different emotional, all of it. And even just, political is a whole other level, but I just love birth work because it resonates out into all of those things. And into our community. And you can really, doing this work and doing it well, I think, make an impact on so many levels.
Yeah, this never gets old. Someone asked me just the other day, do you get tired of delivering babies? And I'm like, no, never. And each baby is as exciting as my first delivery.
I agree.
Like really.
100%. And there's just something, because people say, don't you get exhausted being on call, or isn't it stressful? But there's something really invigorating about this work. And it serves us as well, to have a job that also asks of us to be more compassionate people, to ask of us to show up fully in the room with women is just incredible. And and just to see these and to see that birth, that I think our culture does have a lot of fear around birth. And women are quick to share negative stories or express that fear. And to be in the birth room with women who are having these truly empowered births, truly beautiful births, where I feel partners are coming together and they're working well, feels like a big deal, and feels like this is important. This is important in making an impact and changing what the norm is. Because I do think it's important to change what the norm is around birth in our culture right now.
For sure. Birth is so empowering. And, I'll just use an example of a woman that I delivered last night, first baby. And she pushed and pushed and pushed. And she at some points were like, I can't do this. But I'm like, but you are.
But you are.
You are doing it. You are doing it. that
That's
you
so funny
are
you
doing
say
it.
that.
Yes.
Can I just share something real quick? So
Please.
that is so funny because that is my favorite thing. When I was personally in labor with my second, I started saying to my husband, I can't do this. I can't do this. And which is what I always tell my clients not to say, right?
Yes.
That's not a birth affirmation. And I just remember I looked at him, I was like, I can't do this. And he looked at me, eye contact, and said, you're already doing it.
Yes.
And that was such a big moment. And then we kept doing that through every contraction.
Yes.
I can't do this. And he would say, you're already doing it. And there was something so freeing for me to just be able to admit, I can't do this. But then to get this response, like you so well supported your patient, you're already doing it. And support changes things. It just does. And we underestimate that. We underestimate it so much. But if we look at it in life, even like you mentioned earlier with your parents were so supportive when you said, I want to be a doctor, and they set things up for you. And that support changed your outcome to become a doctor.
Yes.
And the support in the room with birth changes outcome. We see that, the numbers are showing us, the evidence are showing that. So it's disappointing that we don't give that, I don't know, we don't honor that strength that it has.
Because it's a really big deal.
It's a really big deal.
A huge milestone. And I enjoy taking care of women because women are kick ass.
Women are kick ass. I
women
love working with women. Every time it's like, women are kick ass. Like, how does everyone not know this?
Exactly. And you and I have the privilege and the honor of seeing that every day, every single day.
Absolutely. I mean, it's just, so the name of my business, Philomena Birth, people always ask me about that name. And Philomena was actually my mother's middle name. So it's named in her honor. But also when I was thinking of the name, I looked up Philomena, and Philomena has a few meanings. One is one who loves strength. And I love that meaning because that's what I see. Just like how you say women are kick ass. Like I love just witnessing this strength in women that sometimes they don't even realize they
didn't even know they had it.
They didn't even know they had it. And then they have a moment and everything clicks and they're like, wait a second, and boom, they can labor on, right?
Yes.
So and to be able to witness that and to help that come forward in somebody is really an honor, is truly an honor. And like you said, it's inspiring to be there. And to just do this good work.
One of the things that, people always, and I'm sure that your clients tell you this, how much they gain from you. And I tell people all the time, what you all don't realize is how much I gain from you. I get so much from you. Yeah.
It's incredible. I mean, it's truly, and I don't say this lightly, like this is my life's work. And I know that. And I feel, I just feel like each birth I attend teaches me so much and gives me so much that honestly, I even trying to describe it is difficult. Because especially in our society, to just be able to be with people, with them being vulnerable, with them even inviting me into their birth space, it's like, what an incredible honor, Right. This is a pivotal moment in your life. This is a moment where it's going to be raw. It's going to be hard. And you're trusting me to be by your side and to guide you in some ways. Like I'm humbled every single time, Dr. Angela, and I don't take it lightly. I try to, I try to show up fully for each and every family. I try to stay educated on everything I can around childbirth and just, continuously honor that gift of being invited into that room.
You're pretty fantastic. And honestly, I'm going to tell you, I could probably talk to you like forever and ever and ever. and I am definitely gonna have you back on, because there's so much stuff I want to talk to you about, natural pain management. That's like a whole another podcast. And
that's
really,
a whole episode. And I would
yeah.
love to talk about that, because there are just so many different ways to manage.
Yeah.
And one of my biggest things I talk about in all my classes is the difference between working hard through contractions and suffering through contractions.
Yeah.
And that there's a clear difference. And
Sure.
there are things you can do to stay in a good flow zone in this nice working hard place. But nobody should suffer through labor. So even when we were talking earlier about the epidurals, like if you find yourself stuck in a suffering cycle, that's when we utilize that tool.
Sure.
Right.
Sure.
So anyways, yes, I think we should talk about that.
So I am going to have you back so we can talk about that. But in closing, I really want you to just tell women where they can find you and the services that you offer.
Absolutely. Thank you. So my business, like we said throughout, is Philomena Birth. Our office is located in Red Bank, New Jersey. And we offer birth doula support. So we've talked a lot about that today, as well as childbirth education classes. We do all the group classes that we talked about, as well as private one-on-one classes. Reach out, and then we do the breastfeeding support, a little bit of postpartum support as well. But really my goal here in our Red Bank space is just to create a community center for families, a community center for birth workers even. So please reach out. We're passionate about what we do over here. And and then I'm on Instagram as well, just Philomena Birth on Instagram.
So first of all, I just want to say thank you so much for agreeing to be on my podcast. You are my first guest back after a pretty long hiatus.
Oh, wow.
And I can't think of a more appropriate way to kick things back into gear. So thank you, and thank you. So one of the things I always also do in closing is read like some word of inspiration from one of the many books that I have on my desk in my office. And one of my favorites is this book that I must have gotten when I was in high school. I'm a very sentimental person, so I have a lot of keepsakes. But this is called She Went Out on a Limb, and it's a book of inspiration for women. It's by Sandy Gingras. And what I chose for today says, don't spend your whole life getting ready. Mm-hmm. You know, and I think that that's really important. It's, you know, don't spend your whole life getting ready, but actually join the big dance. It's important to take action. So in closing, again, I want to say thank you so much to Mary for being on the podcast. You all know me, your girl, Dr. Angela, everyone's favorite OBGYN. You can follow me on Instagram, Ask Dr. Angela. I'm on Facebook. I'm really not on X anymore. But that's like a whole nother story. But you can visit me at my website, www.askdrangela.com. That's AskDrangela.com. You can submit questions, topics that you want to hear about. I am excited to kick off. I'm doing a series on menopause, which will be episode number 340. So keep your eyes and ears peeled for that. Until next time, choose happy. Thank you.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at AskDrAngela.com/terms.